Have you ever experienced chest pain where it felt like your chest was being pushed on, squeezed, or too heavy to bear? Has this pain ever radiated down your arm or into your shoulder? Have these events been accompanied with shortness of breath, dizziness, nausea, or even exhaustion? Then you might be one of the 20 million people experiencing symptoms of angina.
Hi, my name is Jade. I'm a student nurse here at LSUA. Angina is a symptom of coronary artery disease. Angina is caused by inadequate blood supply to the heart. This lack of oxygen could be from plaque in your arteries, blockage in your heart, or inadequate management of your underlying medical conditions. Because your heart's not receiving enough blood or oxygen, it's overworking itself and may eventually give out.
Nitroglycerin works to relax the smooth muscle in your body, causing vasodilation of your blood vessels to supply more blood and oxygen to your heart. This medicine will help relieve your acute anginal pain and can minimize the risk of anginal attacks before stressful events. It can also help with perioperative hypertension, heart failure related to acute myocardial infarction, and control hypotension during surgery. To prevent chronic anginal attacks, you can use the 2% ointment cream starting at 1/2 an inch of ointment, increasing by 1/2 an inch until desired results are achieved. The recommended dose is 1 to 2 inches every 6 to 8 hours. The transdermal patch can be used as well, starting at 0.2 to 0.4 milligrams per hour once daily, applied for a total of 12 to 14 hours. For acute angina pectoris, or to prevent or minimize anginal attacks before stressful events, use 1 sublingual tablet dissolved under the tongue or in the cheek as soon as angina begins. You may also use 1 or 2 meter dose sprays into the mouth, preferably onto or under the tongue. Lastly, you can use 1 or 2 packets of the sublingual dissolvable powder dissolved under the tongue at the onset of angina, or 5 to 10 minutes before activities that might precipitate an acute angina attack. For all doses, take the medication regularly as prescribed and have it accessible at all times. Do not take nitroglycerin if you're pregnant, breastfeeding, have liver disease, kidney disease, severe anemia, recent head trauma or hemorrhage, or have an allergy to nitrates. Use caution and talk to your doctor about taking this medication if you have a history of low blood pressure, low blood volume, aortic stenosis, tamponade, or taking the medications heparin, ergot derivatives, or drugs for erectile dysfunction. Do not stop drug abruptly as it may cause coronary artery spasm. Tell your doctor or get medical help right away if you have any of the following signs or symptoms that may be related to a severe adverse effect. Signs of an allergic reaction like rash, hives, itching, red, swollen, blistered, or peeling skin with or without fever, wheezing, tightness in the chest or throat, trouble breathing, swallowing or talking, unusual hoarseness or swelling of the mouth, face, lips, tongue, or throat, very bad dizziness or passing out, fast, slow, or abnormal heartbeat, flushing, blurred eyesight, dry mouth, sweating a lot, pale skin, or restlessness. To assess if nitroglycerin is being given at a therapeutic dose, your nurse should assess for the following: changes in skin color or any signs of irritation on the skin if using the transdermal patch, adventitious lung sounds or labored breathing, changes in heart rate or blood pressure, increase in pain level and increased frequency of precipitated angina, altered level of consciousness, slow reflexes, and risk of safety due to dizziness. Make sure when taking nitroglycerin, you lay down or sit down prior to administration in case of dizziness. Always check the drug's expiration dates and don't expose this medication to heat. Keep a record of sprays if using translingual option. Taper drug after long-term therapy. Administer with small frequent meals to help with GI upset. Try to participate in activities that decrease your stress. If you have taken the max dose without relief, please go to the ER.